everybody for being here today. Thank you. I'd like to get started, and I understand that it's pretty warm out today, but there's a lot of shade over here, so feel free to move in if you'd like. We don't want anybody to get dehydrated. I'm Bonnie Maldonado, and I'm a professor of pediatrics, epidemiology, and population.
It's really hard to hear.
Come in closer.
Come on in. There's lots of room over here. And I'm also the Senior Associate Dean for Faculty Development and Diversity here at the School of Medicine. I have a few words, and then we have some really amazing speakers here. You can't hear me? Come on back. Come on back here. There's plenty of room. Can you hear me now? Okay. Move on back over here if you want. I have a few words, but I will actually turn it over to colleagues here to really express their own feelings about community today. So dear Stanford Medicine community, thank you for joining us today to reflect on the recent somber and transformative national actions taken by the Supreme Court of the United States, actions which will affect each and every one of us in some way. I want to thank Dean Lloyd Minor and also Paul King, who is the CEO of Packard Children's Hospital and Stanford Children's Health, for being here today and offering their support, and for David Entwistle, the CEO of Stanford Healthcare, who is traveling and can't be here today, but also offered his support in an email to me regarding a right to choose. And we'll have a short statement that they put out this morning as well. Today, we want to take time to share our collective distress regarding this precedent in restricting an individual's right to access reproductive health across our great nation. Because of this decision, gender health equity, especially around reproductive health, has been dealt a blow from which it will be difficult to recover. Millions of Americans are now without access to the same reproductive health care that Americans have had for nearly 50 years. The Supreme Court's decision in Dobbs v. Jackson Women's Health Organization incorrectly says that abortion is not deeply rooted in our nation's history. In holding that, and importantly, Friday's decision calls into question other rights that we thought were settled. The right to use birth control, the right to same-sex marriage, and more. The great aspiration of our nation has been to expand freedom, but the expansion of freedom is not inevitable. It is not something that just happens. Not unless we defend our most fundamental principles, and not unless we elect leaders who stand up for those principles. The strength of our nation has always been that we move forward. We must now come together to show what kind of country we want to live in and reject the notion that our rights are up for debate. So today, we are fortunate to have a number of speakers from our Stanford Medicine community to help us articulate our concerns. The first person I'd like to invite up to speak is Dr. Leslie Subak, who is professor and chair of the Department of Obstetrics and Gynecology. Thank you.
I want to say that I normally like to speak from the heart and with passion, but I have so much passion about this that I will run on for about 2 hours. So instead, is that better? Okay, great. So instead I'm actually going to, louder. All right, I'm going to give it a go, and I'm sorry for the people in the front. All of you speak really loudly, right in the microphone. I'd like to just speak from the heart, but there is so much heart that I have, and I'm actually going to do a little bit of reading also because I want to make sure I hit important points. As some of the signs say out here, abortion is essential health care. Though we knew this day was coming because it was foretold in early May, we weren't surprised, but our feelings of outrage and shock, of grief, of disappointment, and that's just a few of the emotions. Those are so big for us. So I want us all to hold that, to honor that, to feel it, and now we're going to move ahead because we have a lot of action to do. We're here today to share our sadness, but also to gain strength in our solidarity and to inspire action to support reproductive choice. We're here as a community to support each other and support our beliefs that all people, including women and sexual gender minorities, pregnant people, people capable of becoming pregnant, deserve comprehensive, safe, patient-informed care that is done in collaboration with their beliefs, their people, their healthcare providers. We are committed to supporting and providing this comprehensive reproductive choice for women, and abortion is essentially a part of that safe health care. Our patients are extraordinarily fortunate here in California that we can care for them with such compassion and such passion. However, we now live in a country where half the states will not have access to abortion. I want to repeat, abortion is essential health care. So physicians and practices will be forced to practice medicine counter to our best available evidence, counter to our training, counter to our professional judgment, and our ethical obligation to our patients. Not okay. By putting physicians in fear of retribution for providing evidence-based, appropriate life-saving care, and it denies patients the ability to make their own choice, to have domain over their bodies. From an equity lens, we know that this is bad. These bans will most affect pregnant people already marginalized in society, including people of color and LGBTQ+ people. The consequences of this decision will be sweeping, not only by opening the floodgates to widespread bans on abortion, but also for what it represents, a narrowing of our rights to privacy and bodily autonomy. This threatens rulings that support our rights to contraception, trans rights, interracial marriage, same-sex marriage, parental and family rights, assisted suicide, and many more civil liberties. A small note, personally, I grew up before Roe versus Wade. Women in my family talked about their struggle to get adequate birth control, talked about abortion at our dinner table every Sunday when 4 generations of family gathered. My grandmother had eclampsia and was told by her physician to not get pregnant again or she would die. There were no contraceptive choices in the 1930s and 1940s, so she went on to get pregnant 3 more times and had illegal bathroom abortions with horrible stories of her fear, her trauma, her infections, her healthcare risk. Finally, on her 4th pregnancy, she decided it was worth it to risk death. Luckily for me, she did. It was my mother. But these stories impregnated my growing up. And with Roe versus Wade in the 1970s, it changed everything for women. And the thought of going back is absolutely horrific. So here are some things we are doing at Stanford. We are proudly and unapologetically providing abortion care. You're going to hear from some of us. We are training our medical students, residents, and fellows in abortion care, and we're accepting visiting residents and medical students from restrictive states for abortion training. While I'm saying these words, it's really some of the people standing here and some of the people out there who are doing this work that is so admirable and really impacting healthcare. We're also doing research to minimize the burden on women traveling for abortion care, including non-sedating pain management strategies for uterine aspirations and alternative follow-up strategies after medical abortion to improve access for everyone. So here is how California has been preempting this decision. The California Future of Abortion Council, very active. It's comprised of reproductive freedom and sexual and reproduction healthcare allies, partners, and leaders. They've drafted a blueprint outlining 45 policy recommendations for policymakers that can be implemented to better prepare California as the threat to abortion rights and access continues. And a bill has been introduced in the California State Senate, SCA 10, that's an explicit constitutional right to abortion and contraceptives. We are the very happy recipients of a very supportive environment in our state. This would ensure that for the long run. So there are many ways that you can help. You're here today. Thank you. Talk about abortion. Say the word abortion. If you have friends or families in North Carolina or Illinois, consider asking them to host people traveling from out of state seeking abortion care, as these are the states anticipated to have the highest surge of patients. Call, email your senators to support abortion, and we've got some links that will be on our website to help you do that. Donate, if you can, to anything that will help with abortion funding. Okay? And please take the time that you need to process this news, to nurture and to heal. Take care of yourselves so we can continue this life-saving, life-affirming, life-changing work. Thank you for being here today. I'll next introduce Stephanie Melfar. Stephanie is a chief resident in obstetrics and gynecology and has served as the resident representative to our diversity, equity, and inclusion group in OBGYN. Stephanie?
Hi everyone, my name is Stephanie and I'm a chief resident here at Stanford OBGYN. I am also a first generation Mexican American and first generation college graduate in my family. I grew up in a very politically conservative part of California that many people do not know about, which is the Central Valley, where equitable access to care was not possible. I grew up in Tulare County, which had the highest teenage pregnancy rate in California and one of the highest in the country while I was in high school. These were my friends and my own family. I witnessed the consequences that came from the lack of having access to equitable care and a lack of access to options counseling, including the option and fundamental human right to have an abortion. I witnessed firsthand the maternal and neonatal morbidity that comes with continuing with an undesired pregnancy in a community that is not able to provide equitable prenatal care. I also witnessed the social stigma that came of being a teen mother, the stigma inflicted by the very same persons who believe their own anti-choice beliefs on these now mothers. Fast forward a decade and a half later, and I stand in front of you. I stand before you grieving the loss of a fundamental human right to many persons across the nation. My heart continues to ache for the grave loss of not only access to abortion care, but also the access to abortion education amongst my OBGYN colleagues across the country. They lost or will be losing the ability to provide care for undesired pregnancy and even lose the ability to provide evidence-based medical care for ectopic pregnancies and will lose the ability to provide emergency contraception. What would be a really simple consult for me here at Stanford is now a very palpable matter of life or death for a patient that has lost their right to abortion. My heart is also scared for what the loss of this fundamental right means to those for other rights that we have so passionately fought for, especially for our most vulnerable and marginalized communities. I reflect on my education and abortion training here at Stanford as an OBGYN resident, and I look forward to return to the community to provide abortion care that many of my own friends and family did not have. As a Latina physician, I am humbled to partake in this fight to combat the health disparities of these underserved communities, particularly those inflicted on persons of color. I am proud to be a first-generation Latina physician, but today I am most proud of being an abortion provider. Thank you.
Dr. Mills, for everything that you have done and that you will do. I'd like to introduce now Haley Miller. Dr. Haley Miller is a fellow in high-risk obstetrics here in the School of Medicine.
Thank you. Good afternoon. My name is Dr. Haley Miller. I'm a maternal fetal medicine fellow here at Stanford University. I am a physician and I'm an advocate for abortion access and rights. I'm honored to represent OBGYNs at Stanford University in California, proudly saying abortion is healthcare. As physicians caring for complicated pregnancies and patients making some challenging decisions, we will not sit back and watch as states try to pass lies with legislation. Abortion access is imperative to what I do every day as a high-risk obstetrician. Abortion bans are filled with misinformation and do real harm to pregnant people. Abortion is the fastest, safest way to reduce the risk of death for people who experience complications in pregnancy. Without abortion, women will die. Access to safe, evidence-based legal reproductive health services is critical to individuals' overall health. Reproductive health decisions, including abortion, are best made by an informed person in consultation with their healthcare provider. The complications that can arise in pregnancy are complex and unpredictable. Highly trained medical professionals cannot foresee every pregnancy problem. Therefore, legislatures cannot be expected to do so. Legislation attempting to limit pregnancy termination to specific gestational ages or conditions will harm those facing unexpected pregnancy complications. I speak out today for all the patients I take care of who will ultimately be harmed by lies. I speak out for those with a desired pregnancy with an unexpected, devastating diagnosis and their want to prevent suffering and grieve how they need to. I speak out on behalf of the patients who are miscarrying and need medical assistance that can be pushed out of reach because of abortion restrictions. And I speak out for patients with a health condition where pregnancy puts their lives at risk and all their loved ones who are with them on that journey. Abortion is healthcare, abortion is safe, abortion can be life-saving. We must protect access to abortion. As a physician who takes care of people with the most complicated pregnancies, I will always fight to protect their access to abortion care. Abortion care is essential to healthy communities and healthy families. Introduce one of the newest members of our Stanford community, Dr. Mehdi Marquardt.
Hi everyone, can you hear me okay? All right, thank you for the kind welcome. My name is Dr. Mehdi Marquardt, a first-year resident physician who is beginning her training in obstetrics and gynecology here at Stanford Healthcare. A few months ago, when I was making the critical decision of where to train, I considered Roe v. Wade being overturned a somewhat distant possibility. Nonetheless, I factored that into my decision-making of where I'd like my career to be shaped as a reproductive health physician, based on the national conversation at the time. Today marks my official first day of residence, and had you told me I would be here speaking at a rally after Roe v. Wade had just been overturned on my first day of residency, I still would not have believed you. But boy, am I glad to see you here at this report. Now more than ever, I do not take lightly the privilege to be at a place where my training to provide essential, holistic, and safe healthcare to my patients is not limited. For many of my colleagues across the country who also came into the field of reproductive health seeking to bridge the health equity gap like me, this might not be the case. and the consequences for the future of reproductive health physicians is dire. I am no stranger to such restrictions. You might be wondering where this accent is from, but I grew up in a part of the world where abortions were generally considered a criminal offense, permissible under very few exemptions. The ramifications were deep. Abortions were highly stigmatized, and small clinics with untrained providers carried out clandestine operations in tiny, impoverished neighborhoods where pregnant people without the financial means to travel out of the country went to take care of things. I have experienced firsthand lives lost and people's future reproductive potential jeopardized, all because they did not have access to safe abortion. I have also experienced firsthand how access to safe abortion has empowered birthing people to decide how their life plays out. What the Supreme Court's decision does is draw a line that further convinces those who are already marginalized that their voices do not have room in our national conversation, that their bodies are invisible. This is more than just the right of birthing persons. It is about widening the health equity gap in a country where maternal mortality is disproportionately higher in people of color and in people of lower socioeconomic status. In a country that leads the world with cutting-edge healthcare innovation and evidence-based medicine at its hallmark, delaying access to essential healthcare services, such as abortion, is antithetical to its very creed. The evidence is clear, and has been clear for a long time, on what policies reduce abortion, access to free contraceptives, comprehensive sex education, universal health care, paid family leave, welfare funding, ending housing insecurity, closing the wage gap, and funding education, among other things. We must believe the voices of reproductive healthcare providers who declare abortion is essential healthcare. We must believe the voices of birthing people who deserve the autonomy to navigate the complexities of their own pregnancy journey. Birthing people should not have to prove their worth or the soundness of their decision for us to act on their behalf. We do not have to understand every nuance of the indications for an abortion before leveraging our voices to advocate for safe abortion. For justice does not discriminate. It upholds the dignity of all involved. True justice is overwhelmed with a compassion that is urgent when the rights and freedoms of a fellow human being are infringed. I will end by saying this. None of us began here in a vacuum. There was a body that carried us, one worthy enough to determine its capacity to nurture us. And because none of us exist in a vacuum, we owe it to the bodies that birthed us to secure the simple freedom of choice for all. Thank you.
The speaker is at its highest volume, so if people feel like they want to move up the stairs, feel free to do so. We're really trying to speak as loud as we can here. But thank you again for being here. So I would like to introduce Dr. Sedona Murphy. Oh, she's a PhD candidate. Sedona Murphy, who is a PhD student in genetics in the DEI Group's liaison for BioAIMS, and the 2022 awardee of the University President's Award for Excellence Through Diversity. Thank you.
I'll do my best.
Hold it real close.
I'll do my best to project, but I don't have the loudest voice. But I'm here as I'm not a medical doctor, but I'm here to have a call of action for researchers in particular. And I want to just acknowledge that our history, especially in the state of California, as researchers is quite marred in actually removing bodily autonomy from the most vulnerable communities. We have a history of eugenics enforced
sterilization, and that's just to say that we as scientists don't exist in an apolitical vacuum. It is important for us to be political actors. Sorry, this is gonna come I never thought that at 22 years of age, in a country that I knew the right of choice this entire time, it would be removed, but seriously imploring my fellow researchers to not be neutral, to not turn away. This is important, and we owe it to our history to be loud, to use our privilege, especially to protect those that are most vulnerable, because that's who is really going to be affected by this. So that's all I have to say. Just let's stay loud and not forget our past, even if it's dark. We can do better as a community.
Our last speaker for this afternoon is Dr. Kate Shaw, who's Associate Professor of Obstetrics and Gynecology, Division Chief of Gynecology and Gynecologic Specialties, and Director of Fellowship in Complex Family Planning. Thank you, Kate.
Hello. It's so incredibly meaningful to have you all here during this time for community and solidarity as we fight to get our patients what they need. Abortion is healthcare. I'm an OBGYN and a complex family planning specialist. I'm a clinician, an educator, a researcher. I care for people in the gynecology clinic. I'm a surgeon. I deliver babies, and I'm a doctor who provides abortion. Abortion is common, abortion is safe, and today, unlike much of our country, abortion is still legal in California. We have all known, loved, taken care of, or been a person that needed an abortion. Over the last 50 years, 1 in 4 people with uteruses have had an abortion in their lifetime, yet access was already limited. Only 1 in 3 medical schools teach about abortion, and only 1 in 4 OBGYNs perform abortion. And now, nearly half of OBGYN residents no longer have access to training, and half of our country no longer has access to this essential, life-altering, life-saving procedure. I grew up here in Northern California. In my house, we talked about menstrual cycles, sex, contraception, and abortion. I learned early on about the complexities of an abortion, the feelings, the ambiguity, the conflict and tension that abortion brings about. Being in the Bay Area, though, I took abortion access for granted. I took for granted that it was a person's right to make private decisions about their body, their pregnancies, and their health. That it was decided, guaranteed. We should never take things for granted. As an abortion provider, I have the privilege of hearing the stories of pregnant people seeking abortion. The 42-year-old mother of 3 whose IUD failed, the 14-year-old who didn't know she could get pregnant before she had her first period, the 26-year-old who thought he couldn't get pregnant while taking testosterone, the 22-year-old who was just accepted to medical school and became pregnant after a condom broke and emergency contraception failed, the 32-year-old mother of 2 who had just escaped an abusive relationship only to find herself pregnant by her abuser, the 27-year-old who last month was protesting outside the abortion clinic, the 28-year-old who tried to get pregnant for 2 years only to find out 4 months into her IVF pregnancy that her baby was not going to survive birth, the 27-year-old who wanted nothing more to be pregnant but was told to get a 50% chance of dying if she continued, the 35-year-old with a highly desired pregnancy in the ER hemorrhaging who needed an emergency procedure to save her life, and the 23-year-old who didn't share their reason but had an ordinary, uncomplicated procedure to become unpregnant. No story or person is the same. As As a doctor who provides abortion, I'm not surprised by the court's decision. With every one of hundreds of abortion restrictions that have been enacted across the country over these 50 years, we have reacted, adapted, and persisted. Clinics and providers have worked as best we can to ensure that people coming to us for help can get a safe, legal abortion with compassion and kindness. And we have all allowed these restrictive policies to permeate into our clinics and into our relationships with our patients. Now with the Dobbs decisions, 26 states have already or will soon ban abortion. This past Friday, hundreds if not thousands of pregnant people were turned away from clinic waiting rooms across the country. Those people with the means will be able to travel out of state, but most will be left behind, unable to afford the cost of childcare, time off work, travel, and the procedure. Hundreds of thousands of pregnant people will no longer be able to decide what to do with their body and their pregnancy, and their doctors will be unable to help them without risk of breaking the law. In states where a pregnant person's life must be threatened in order to have an abortion, doctors across the country are left uncertain what will be considered an acceptable interpretation of life-threatening by prosecutors and lawmakers who have no medical training or knowledge, leaving doctors fearful to treat sepsis, hemorrhage during pregnancy, and even ectopic pregnancies, leaving people waiting until death's door before treatment is given. Restricting abortion does not prevent abortion, it only makes it unsafe. It has been shown over and over in countries across the globe that legalizing abortion prevents death and complications in pregnant people and infants. Limiting access to abortion is a health equity issue. Like so many regressive policies, we know those most impacted will be the communities and individuals already marginalized. So here we are. While many countries are decriminalizing and legalizing abortion in an effort to protect their people, preventing women and pregnant people from unnecessarily dying from complications of pregnancy and unsafe abortion, our Supreme Court has failed to protect women and pregnant people, failing to protect the right to privacy and gender equity, moving us backwards. Our ability as doctors to help those in need is now regulated by lawmakers, and it does not end here. With this decision, access to contraception, fertility treatment, LGBTQ rights, gender-affirming care, and marriage equality are all threatened. Being in California, we cannot take the right to an abortion, privacy, bodily autonomy for granted any longer. Pay attention to what's happening. The threat of a federal abortion ban is real. Wake up, talk about abortion, say the word, take action. When you leave today, call, email, or tweet your senator and ask them to protect abortion in all states and the right of private people to access essential health care in their home state, to make decisions about their bodies, their pregnancies, and their lives. Beyond merely continuing to provide abortion care as permitted by California law, at Stanford, let's be leaders and advocates in ensuring comprehensive, safe, and legal access to abortion, and that all essential health care is able to be decided by an individual and their doctor. Abortion is essential health care. The right to abortion is not decided nor guaranteed. Do not take it for granted. Do something and do it now.
Thank you, everybody. Thank you for standing out here in the sun. I know it's probably pretty hot for some of you in the back. This is our amazing group of speakers. I want to ask you to thank them all for their work. Listening to the messages. We cannot take our freedoms for granted. They are not given to us freely. We have to take them. We have to vote. We have to be informed. We will do everything we can to help keep you informed so that you can decide for yourself what to do about your own body and your own families. So at this time, I wanted to stop, but I wanted also to thank the members of the Office of Faculty Development and Diversity who were able to help us organize this in just a couple of days. Thank you so much for taking the time. And as you know, there have been messages posted to Stanford Medicine. please make sure you send them to our office, and we will make sure we will try to answer questions. We obviously are not in the business of reproductive rights in my office, but we will make sure we can access people who do have those answers. Thank you so much for being here today.
Yeah, for sure.